Some of the most common procedures I perform are surgery for nasal obstruction and rhinoplasty. A lot of patients come see me because they're having trouble breathing through their nose, and then we talk about some of their aesthetic concerns. There are a lot of patients who undergo surgery for nasal obstruction alone, and some patients undergo both cosmetic and functional rhinoplasty. The evaluation for this starts with an evaluation of the nose, doing a thorough nasal exam to ensure that there are no other reasons for nasal obstruction. And some of the common procedures that I perform for this are septoplasty, inferior turbinate reduction, and nasal valve repair. In terms of a cosmetic rhinoplasty, the consultation involves going through some of the goals and concerns for the patient regarding their nasal appearance, and then we can discuss some of the changes that they would like to achieve, as well as potentially do some morphing imaging to visualize the expected results. Each patient's anatomy is very different when it comes to rhinoplasty, and therefore each rhinoplasty is very different. It's important and essential to ensure that the patient's goals are being performed or achieved, and therefore each procedure must be tailored to achieve those goals. Rhinoplasty can be an outpatient procedure. Sometimes it becomes an inpatient procedure if the patient has obstructive sleep apnea, which the hospital requires an overnight stay. Generally, most people take 1 week off of work or school after a rhinoplasty or surgery for nasal obstruction. Following the removal of stitches, they can go back to work and resume their normal activities. I ask that patients take off 3 weeks from strenuous activity, but they're welcome to exercise during this period. It takes 1 year to completely heal from a rhinoplasty, but that does not mean that results will be achieved much sooner than that.